are in good shape. So make sure so you know those pectoralis majors and serratus anterior muscles. No need. Oh, one more thing in this picture. See how by the breast there is like a tail going all the way in the axillary area? That is called the tail of Spence. The reason why you need to know that it is because most cancers, breast cancers, occur on the tail of Spence and usually on the left side, usually on the left breast. So know that. Nothing on mammary glands, nothing on the, just know the pectoralis, what is its purpose. This is nice to know, the milk line. When we are infants or we during development, there is this line of that during fetal development, this line is called the milk line. It is there during the fetal stage, but as we grow up, it disappears. So, but occasionally you will see a mole, extra mole, an extra, if you will, like an extra nipple, and you have to distinguish that from a mole. So see, like that is an extra nipple, but it is almost like a mole. In my 26 years of nursing, being in the trenches, I only saw one person with this, one female, but I wasn't sure. So I asked the doctor, he says, it's an extra nipple, but it wasn't grown or anything like that. This is important as to how do we document. We divide the breast in quadrants, and that's the way we will say on the upper outer quadrant, the lesion is located at the level of and at the 2 o'clock position or things of that nature. So the breast quadrants are utilized for more exact documentation of lesions. Drain and lymph, the axillary and lymph nodes, you already know that we have lymph nodes throughout our body, and usually when they are non-palpable, and if they are palpable, that indicates most of the times infection. And with the breast, the lymph nodes drain lymph and return it to the blood, and they are superficial and deep, usually non-palpable. Internal nodes drain towards the abdomen and opposite breast. And the male breasts has the same potential to develop cancer, but it's very rare, breast cancer in the male, but they do have the same potential. Nothing on the nodes. Pectoralis major and serratus anterior. Overall contour determined by suspensory ligaments, major function of the muscles of the chest to support the breast and lymphatic tissues. And we mentioned that earlier. And the lymphatic drainage of the breast, that is mainly nice to know. Age, we have to spend some time here. Goals of People 2020 emphasizes screening for breast cancer, reduce the number of deaths caused by breast cancer. You know that breast cancer is curable if it is caught in the earliest stages, like 1, 2, and 3, but 4 is questionable. Nothing on this slide examples of healthy people. Nothing on infants and children's. Pregnant female, the enlargement of the breast tissue for lactation. There are pigmentations in the breast, and there is colostrum leakage prior to childbirth. But this is that we concentrate on the older females. There is a limited range of motion for examination. Like sometimes the best way to examine the breast is to put your hands around your neck, and yeah, just on your hair, but around on the back of your neck. And sometimes because of arthritis or because of weakness of the muscles, women cannot do that. Some of them, the older adult. There is changes in the breast tissue composition, which I said it becomes as we grow older, fat, especially if we don't do exercises. Gynecomastia in males know that it means enlargement of the breasts. And breast cancer, know this: breast cancer increases with aging. As the person grows older, they have more risks for developing breast cancer. Self-esteem and femininity. Many women believe that and have idealized the perfect breast, and so because of that, and sometimes they are afraid to go to have a mammogram because they are afraid that they might tell them that they have cancer. So they have fear of performing breast self-examinations. In men, specifically if men, they find any type of lump on their breast, they may delay it because they fear, they are embarrassed that they may have cancer. But we have more risk factors of developing breast cancer if we are older, overweight, and have family who have immediate family who has had breast cancer. Obesity and high fat diets are linked to breast cancer. So know that uh, may be due to lack of seeking breast screening. Also, women who are very obese, they do not go to have breast screening because sometimes their breasts are so large that if they don't fit in the little plate that they have to place on the breast, and so they are embarrassed and they don't go to have those screenings. This is just nice to know. Diagnosis and mortality rates vary across different groups. Minority females may delay preventive or treatment measures due to lack of finances, due to insurances. Nothing on focus interview. Nothing on focus interview. Nothing on breast self-examination. Whenever you have public health, you will have to develop a teaching plan to go and teach breast self-examination in some communities. And this is how to do it, different ways to do your breast self-examination, but nothing, there won't be any questions on that. The assessment of techniques for the breast is inspection and palpation. Because we are not in a clinical setting, like the skills lab, you are not expected to do any breast examination when you do your physical assessment. When you inspect, of course, you inspect the size and symmetry. Both breasts should be equal, but sometimes one is slightly larger than the other, but very small difference. And of course, you have to inspect for color, moles, and other markings. And again, more focus will be placed whenever you go to OB. So this is how you will check whether there is symmetry of the breast. They should be at the same position, not one higher than the other. This is, I don't know how to say this in French, hue of the orange sign. But what it is called, the translation is literally like orange peel. That's how it looks. It is inflamed skin and red and warm, and edema from blocked lymphatic drainage in advanced cancer stages causes an orange peel appearance. So this type of appearance will happen whenever the woman is already in a stage 4. And this is nice to know. Paget's disease of the nipple, nice to know. Um, this is inspection of breast with patient's arms above her head. This is what I was mentioning, that sometimes a limitation, it is noted on the elderly. So you kind of have to adapt whenever you are checking the breast. But again, no, it's not expected for you to do it on this term. No palpation of the breast, and no palpation of the breast at all. This is how you will palpate if you were doing it. Pendulous breast. Pendulous means they are kind of sagging in a way. No inspection or palpation of the breast at all. Palpation of the male breast, but again, you are not doing this. This you need to know. Abnormal findings of the breast. No benign breast or fibrocystic disease characterized by lumps, pain, or tenderness, and nipple discharge as a result of a thickening of the breast tissue. This fibroadenoma is a mobile, firm, well-delineated lumps. No benign breast or fibrocystic disease. Know that? And this is how it looks, fibrocystic breast disease. Sometimes these cysts, they contain fluid inside, and the doctor can just put a syringe and withdraw the fluid and then send it to pathology to find out whether it is cancerous or not. Sometimes the cyst can be solid. And this is how benign tumor will be, which is a fibroadenoma. Abnormalities, we still with no intraductal papillomas, and those are tiny growths of epithelial cells that project into the lactiferous ducts. And I think we have pictures of that. Oh, here is the intraductal papilloma. Know this? Know the signs and symptoms of breast cancer: dimpling of the skin, deviation of the nipple retraction, changes in the shape of one breast, and there is edema and discharge, which usually is the largest. Always study the ones that have the picture, because many of my questions come from the pictures. Cancer is more common in white women. Know that African American, Hispanics, Latina, or Pacific Islander, American Indians, or Alaska Natives heritage. It is more common in African American women of 45 years of age, and it has a higher mortality rate. Okay, so first establish that it is cancer is more common in white women than anybody. However, if African American women get cancer, it's usually about at the age of 45, which is very young. And usually they also have higher mortality rate. So know the difference. I already mentioned you need to know gynecomastia, which is enlargement of the male breast tissue, and that is due to hormones that they take in order to, maybe they develop enlarged prostate or cancer of the prostate, and as a treatment, they are given hormones like estrogen, and so they end up as a side effect with large breast, which is gynecomastia. Carcinoma means cancer, and it is less than 1% on all breast cancers that occurs on men. So it's very rare, but they do have the potential if they are older and they have family, very close family men. So study this. Gynecomastia occurs often in males over 50 due to pituitary or testicular tumors. In males taking estrogen medications or for prostate cancer. It may occur also with cirrhosis of the liver and with adrenal and thyroid diseases. So you can see a male there with breasts, but it is due as a side effect of these medications that they take. Carcinoma of the breast is rare. Predisposing factors include radiation exposure, cirrhosis, and estrogen medications. And this is how it looks, breast cancer in males. And that's it. Oh my goodness, that was quick. Let me see. We went over breast cancer, yes. Okay, so let's go over some of the things that you need to know. Let's see. What are the risk factors for breast cancer? I will mention them, and then you put your finger up or down. If you think it's that is one of the risks, it's up. If there is no risk, down. Okay, so obesity, is it a risk factor for developing breast cancer? Yes or no? Thumb up for yes. What do you think?